Sam Olsen is a 2-year-old male brought in by his mother for a chief complaint of pulling at his ears and fever. Mother endorses that he has been pulling at both ears for the past 2 days. She denies any odor or drainage coming from the bilateral ears, but does note that the patient has had a fever for which he was sent home to daycare for the fever of 100.9. Additionally, she complains of increased fussiness, more prominently at bedtime, intermittent cough, decreased appetite, and increased fatigue. The mother admits even with decreased appetite that the patient still makes good wet diapers and does note that the patient goes to daycare, but no one in the daycare has been sick to her knowledge. She also endorses that she has been using child's Motrin for pain/fever relief at home. Overall, there is no past medical history, hospitalizations, or surgical history. Additionally, Sam has had no chronic illnesses noted, allergies, or medication intolerances. The patient currently lives at home with his mother, father, and 2 siblings, and the mother endorses or denies use of tobacco products, alcohol consumption, or illicit drug use within the home. She does note that the patient goes to daycare, but notes that she feels as the patient is safe at home as well as daycare. The mother endorses or denies any significant family history on her side or the father's and says that they are both home alive and well. Overall review of system is negative except for general GI and ears, for which the mother endorses decreased energy, fever, increased fussiness, decreased food intake, and pulling at bilateral ears. Vital signs are blood pressure 95/58, respiration 25, pulse 98, temp 39 degrees Celsius. The weight is also 28 pounds and height is 2 feet 11 inches. Overall, physical exam is within normal limits for age, excluding bilateral ears. That is where we note that with the otoscope, bilateral tympanic membranes are erythematous and bulging with minimal tympanic membrane mobility, as well as unable to visualize tympanic membrane landmarks due to the swelling. However, there is no drainage or perforation noted. There are no labs that are needed for this patient, and differentials consist of allergic rhinitis, acute otitis externa, and acute otitis media. The patient has not been swimming lately, and the mother has denied any issues with allergies. Acute otitis media is an infection in the middle ear caused by bacteria or a virus, for which the buildup of pus behind the tympanic membrane can occur. The fluid buildup causes inflammation and discomfort, and in severe cases can cause the tympanic membrane to perforate or rupture. Otitis media is often seen in between the ages of 6 to 24 and diagnosed with subjective and objective data found within a physical exam. The plan for Sam is to use high-dose amoxicillin 80 to 90 milligrams per kg per day, for which we will use amoxicillin and do 400 milligrams per 5 mLs PO BID for 5 days. This will equal 7 mLs twice a day. The mother is also able to use over-the-counter ibuprofen for fever and pain relief, and she is able to follow the directions on the bottle as for how she is used at home. Non-pharmacological recommendations include rest, warm compresses that she can alternate between bilateral ears, and fluid. Diagnostic test is to use the otoscope that we had used in the physical exam, for which we can always follow up with at another time to look to ensure clearance of the tympanic membranes. Patient education consists of symptom relief management, such as the warm compresses for the ears, for which she can use a warm compress, wring it out, and let the child lay their head on one side and alternate as needed. It also consists of being that we are using an antibiotic, that this being the first time he may be using antibiotic, or potential side effects such as GI upset, as well as potential allergic reactions that could consist of difficulty breathing, rash, itchiness, but more specifically the difficulty breathing, if that were to happen to take him to the ER. Side effects are mainly the GI upset. It is important to note that Sam can take the medication with food. It is also important to note that he needs to take the entire dose of medications and continue, even though he may start to appear that he feels better. That goes into the cultural considerations, where sometimes lower income areas can possibly struggle with access or affordability to care. That is why ensuring proper diagnosis at initial treatment occurs, as well as education to complete the entire dose. So that way, recurrence of infection hopefully does not occur. It is also important to note is medication adherence for pediatric patients is on the lower end of 50 to 55%, and that we should make sure that compliance is key to assist with that access or affordability issues. Health promotion is to ensure that Sam Olsen remains up to date on his childhood and yearly vaccinations. There is no referral at this time, but if recurrent otitis media infections occur, a referral to an ENT could be made for potential tubes in the ears. There is no initial follow-up that is pertinent, except for he is able to follow up in 2 weeks or sooner if symptoms such as fever or decreased fluid intake worsens. However, he should feel better within the next couple of days, as well as the infection around his tympanic membrane should clear within the next 5 days.